It is time for our visit with Dr. Kevin Kavanagh, who is a retired doctor, retired physician, also founder and president of a national organization called Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
How you doing?
I'm doing really good this morning. I had a little strep throat over the weekend, as you know.
Are you feeling any better?
Feeling wonderful right now. I got on some antibiotics. Of course, that was a big scare. I thought I had COVID. I woke up Saturday morning, and although I've been very careful, not everybody else does in the county, and so exposure was possible.
Right, you kind of figured out where you thought you got it, right?
Well, I think so, yeah. As I have been mentioning on air repeatedly, that in the wintertime, you cannot count on being outdoors not preventing spread, and you can be out walking on a sidewalk and then have a jogger whip by you. Jogger thinks that just because they're exercising, they can't wear a mask. That equates with can't spread the virus, and well, it doesn't. And so you've got to be very careful. Remember, cool air, cloudy skies, low humidity, that all sets up for viral spread. And plus, we may also be dealing with the new viral variant in some areas of the country. And so that will probably hit in this area soon. And so we've got to be extra vigilant.
You, after you got up feeling crappy, were afraid, obviously, that you had the coronavirus. So did you go get a test?
Well, I did, and I had to go about 60 miles away to get one. I was unable to find a testing site that was open and that could give you a rapid result in Lexington. And I was somewhat dismayed on that. Most of the sites, the vast majority of the sites, required an office visit as opposed to just getting a test. And of course, there's a charge with that. One site appeared to have a $98 administration fee. So it's kind of like, well, the test is free, but you come on in and, you get charged otherwise. Kind of like going in to buy a car. You get a free cup of coffee, but you get zapped with other fees. So that's really not the spirit of how this should be operating. And I was somewhat disappointed. There were some sites that did PCR molecular testing, and that was drive up, and that would be good, except the test wouldn't be available because of the weekend until Wednesday. Again, two lessons here. One is we should be doing this 24/7. I don't understand why Saturday and Sunday, when you're losing some days over 4,000 people a day nationally, why Saturday and Sunday should be a day off or a day that we cut back. I really think we need to up the manpower. And this isn't something that can be done overnight, but certainly can be done within a week or so of getting this arranged and getting more additional manpower, even if we have to mobilize the National Guard. Because one of the things you want to do is if you have a positive COVID test and you are very high risk, a senior citizen, which I am, and plus have other medical factors, you would want to get the Regeneron antibodies. And you need to start that within 3 days. The sooner the better. 3 days of diagnosis. And another area that I think could be somewhat improved is that we should have more sites for getting Regeneron antibodies. I, for one, do not know where to get them. I'm sure UK has them and some of our major medical centers, but especially out in the county areas, whether or not there's ample facilities to get them. I can tell you that a lot of the primary care doctors I talked to were pretty much clueless as far as where to get these antibodies. And that's something that could blunt the deaths in Kentucky, and the product's not being used nationwide. And I think that right now would be an optimal time to use it. There is some question on whether or not new variants or viral mutations will be resistant to that antibody. Remember, this is just a single antibody, one type of antibody. It's not like a vaccine that has a whole myriad of antibodies, so it's easier for the virus to avoid. But not being used a whole lot, one would think that even the new strain may not have mutated to where it was resistant to that product. That's another area I think we could possibly beef up our response. Overall, though, I think things are going very well as far as doing things as well as we can do, because I was able to get a test even though I had to drive some. And I should also note on getting the tests is that I think it's very important that the waiting rooms are clear of patients. In the site I went to, no one was allowed in the waiting room, only one person that would come in and register. Other people waited in the car. That's the optimal way of doing it.
They just call you when they're ready for you, I guess.
Yeah, it's like Chick-fil-A. You pull in, there's a sign there, call this number, and and then you go in and there's no one else in the room because the new strain is more infectious. And we've mentioned this also. They don't know how it's more infectious. So we really need to go back to square one on how it spreads and be very careful with how we're living our daily lives because you do not want to get the new strain or even the old strain. One of the things that got my anxiety up a little bit was while I was sitting there to get the test, the provider told me that early in January, he had a infection with a resultant myocarditis, oxygen level dropped, and had a conduction defect. And of course, this is what we're scared of happens with this virus. And another person in the office had their husband have a myocarditis from COVID now. That this was proven and developed a heart attack. And that person was in his early 30s. So again, this is as much a heart disease as a lung disease. And heart problems, I think, may be actually more common. One of the reasons why when you're young, you don't want to get this virus.
Dr. Kevin Kavanagh. Thank you, Dr. K.
Thank you, Jack.